Autoimmunity, when you think about it, it makes no sense. It makes absolutely no sense that the body starts attacking itself. Like, how does that even happen? 1 in 15 people in the US have autoimmune disease. And for some people, it's absolutely devastating. People spend years going from doctor to doctor trying to get to the right diagnosis. And when they finally have the diagnosis, the treatment options are kind of terrifying. You know what I'm talking about. But the question is, do we have other options? And the title of this episode is about nutrition and autoimmune. How can food really be the culprit when it comes to autoimmunity? How is this possible? Let's talk about it. First, as always, I always start with a definition. What is autoimmunity? What is autoimmunity? So to answer that, we first have to say, what is immunity? And of course, that's an insane topic that will take several semesters. So we're going to have to talk about it in a few sentences because attention span. Bottom line, our immune system acts as a defense against harmful invaders like outside bacteria or viruses that can make us sick. Normally, this works fine. We have a cold, the body fights it. The body creates a whole system of cells and cytokines and fights off the invading cold virus. We feel better and we move on. However, sometimes the immune system gets the wrong messaging, and instead of aiming its ammo only to the outside sources, it starts aiming the ammo internally into our own body. The body attacks its own tissues. This is what autoimmune means. And of course, we'll go into more details in a moment. For many people, it could take years and multiple visits from medical provider to medical provider before a diagnosis is made. But as I said earlier, 1 in 15 people in the US have autoimmune disease. So the prevalence keeps going up and up. The problem is that sometimes we can't see autoimmunity. It's kind of silent. It's a slow and subtle takeover. And it's being managed by all different kinds of specialties. Some of it is taken care of by neurology. Some of it is taken care of by rheumatology, some of it by endocrinology. So it's hard to see it all in one place. And the other issue is that it takes a really long time to diagnose. People could feel unwell for years, decades, before they finally get a diagnosis of an autoimmune issue. And that's because in order to get a diagnosis of autoimmune, your blood work has to be positive. It has to have what we call markers. So you can feel unwell and achy for years, have skin issues, joint pain, whatever your issue is. But when you go for the test, they're negative. So you're sent home. But in fact, you're really what we call pre-autoimmune. You're cooking the disease. It just hasn't shown itself yet. So when you look at how many people are already diagnosed and how many people are on their way to diagnosis, the amount of people actually affected by autoimmunity is staggering. Now, the question is, why? Why is this happening? And many doctors will say, autoimmune disease is just genetic, luck of the draw. But if that's the case, why are more and more people being diagnosed with autoimmunity? Why do we have more people happening? Did our genes just change? Or is there more to autoimmune issues than just genetics? Obviously, you kind of know where I'm going, so no spoiler alert there. So to get a better understanding of it, let's go deeper and let's start with the treatment of autoimmune and work backwards. You'll see what I mean. So we said immunity is when the body sees a foreign object and it starts to attack it. After a successful attack, it creates an antibody. So the next time that it sees it, it already knows it's an enemy and fights it efficiently. Okay, so antibodies are made against things that our body sees as an enemy. For people with autoimmunity, the body is creating antibodies against itself. The immune system is attacking antibodies and memorizing the thing that it wants to attack, which is itself. So instead of fighting an infection, it's fighting its own tissue. In RA, the immune system produces antibodies to attack the joints. In lupus, there's antibodies to various tissues in the body. Inflammatory bowel disease, the system is attacking the lining. In MS, the immune system is attacking the nerve cells. In type 1 diabetes, the immune system is attacking the pancreas. Psoriasis, the skin. Thyroid disease, right? It's attacking the thyroid. So this is autoimmunity, antibodies to our own organs. Now, the key to remember that this body has this amazing defense system. It's called innate and adaptive immune system that we use every day to fight off illness and external attacks. But for the person with autoimmune, this body is taking the entire defense system and aiming it inward. So how do we treat it? In conventional medicine, we haven't really figured out a way to reteach the immune system and said, hey, stop pointing inwards, stop attacking the body. Please aim your guns externally and only deal with, foreign invaders. That would actually be a cure. So far, conventional medicine has not come up with a way to redirect the immune system. Its only solution is to shut the whole system down. The medications used for autoimmunity are immune suppressants. Since the issue is the immune system, just shut down the immune system. And there are different kinds of immune suppressants, steroids, methotrexate that just calm down what's called cytokines. And then there are medications called biologics, which attack the adaptive immune system. But at the end of the day, it's about shutting down the immune system. Now, I think you could see the problem here. Yes, these medications work. The immune system calms down. Your joints feel better. Your rash will improve. Your symptoms will get better. But you just shut down your entire immune system, which means you're now open to attack from any foreign invader. I recently did a consult with this amazing woman. I hope you're listening. She's a principal of a school, which means she's around a lot of humans all day long, aka exposed to germs all day. And she said that when she was taking her medication for her autoimmunity, her symptoms resolved. She was feeling great, but she was sick all the time, every time she went to work at school. And so she felt like she had to decide between less painful joints or being sick all the time. That's not the best choice to have. Now, I'm not telling you to stop taking your medication. Please don't stop taking your meds. I just want you to understand that you're not curing your autoimmune issue. You're just shutting it down. And I just want you to understand what's happening. So if conventional medicine is about shutting down the immune system, functional medicine is about finding out what triggered the immune system to turn inward, remove that trigger, and instead of suppressing your immune system, to actually strengthen it. So think of it like this. This is a super oversimplification, so please don't come at me. But let's talk about diabetes real quick. If someone has diabetes, you know that the cause, more or less, is too much sugar, right? So if the person keeps eating the cheesecake, the sugar goes up. And then the medical provider says, hey, your sugar's high. Here's some medications. Let's keep your sugar low. And you take the meds, and of course they work, and they keep the sugar low. But nothing was really fixed, because the real correction would be to have the patient stop eating the sugar, right? That would be a potential cure. But the medication is managing the symptom of the high sugar, but not really curing anything. It's the same here. Taking autoimmune medication just gets the immune response down, but it doesn't actually get to the root cause. So next question, what's the root cause of autoimmune? And the answer is a combination of things. Yes, of course, genes play a huge role, but it's only part of the picture. You have the genetic predisposition. Chronic inflammation plays a huge role. And usually there's also something in the environment that triggers it. And there are many things that can trigger it: a viral infection, a stressful episode, exposure to a chemical. Many of the patients who come to me will say, ever since that, I've never been the same. Ever since I had a cold, ever since a divorce, ever since the birth of my child, there's usually something that triggers them. So autoimmunity is a perfect storm of genes, chronic inflammation, and a trigger. But many autoimmune patients will also have an underlying gut issue. And this is key. Now, for some people, it's obvious, like, yes, my stomach always hurts. But some people with autoimmune might be listening and saying, I have autoimmune issues, but my stomach never hurts. In fact, I don't have any GI issues. So you must be wrong, because my stomach's fine. Well, keep listening and you'll see. Here's the reason why we have to look at the gut for every single autoimmune patient, even if your stomach is fine. Because autoimmunity is a problem with our immune system. And 70% of our immune cells are housed in the gut. That's why we start there. This is really important, because so many people want to skip this step. Many people don't want to do the work necessary to work on their gut. Many people will say, it's my hormones. It's because I got sick. It's because I'm exposed to mold. Maybe. Maybe all that is true, but you can't manage any of those things if your gut is a hot mess, because it's literally the headquarters of your immune system, which is the issue with your autoimmunity. It's the foundation of your immune system, and we have to start there. So far, so good. I just want you to understand this visual. And if you listen to any of my other episodes, you know this already. But here's the thing. Humans have more bacterial cells, a lot more, than human cells. Take a look at yourself, look in the mirror, because actually there's more of them than there is you. It's just you could see your cells because they're bigger. Bacteria live in the skin, in the nose, in the ears, and most of all, in the gut. We often think about bacteria as kind of being outside of us, something we have to kill with antibacterial soap. But no, they live inside of us, and they are a critical part of our health. We used to think, all right, these bacteria in our belly are like on one side of the gut, and we're on the other side. But actually, we've come to appreciate that our cells, and their cells interact. Our immune system is constantly in communication with these bacteria. And in fact, the byproducts of the bacteria affect our entire system. It's not just that we interact with this bacteria. The reality is we could not function properly without bacteria. So when the bacteria is happy, our immune system works well. But when these guys are not happy, they can really mess with our immune system. This is why gut. The bacteria in our microbiome affect our metabolism, our digestion, our detox, our neurotransmitters, our vitamin synthesis, immunity. We have good bacteria that work with our system. We have pathogenic, bad bacteria that can cause disease. And we have some bacteria that are in the middle that get activated. We're in a disease state. So we have to do everything we can to maintain peace. Now, this is a lifetime of balance. We're actually born without bacteria in our belly. And from the very first feeding, we start getting inoculated, and we keep growing the population in our microbiome as we're exposed to more things. Foods, pets, nature. Every time you touch nature, it goes into your microbiome. But also on the other side, chemicals, medications, antibiotics. Everything we eat or ingest affects our microbiome. So we have 70% of our immune system sitting in the gut, in the same area where most of the bacteria sits. You can start to see why we need to keep these guys in check. If they're off, our immune system's off. Not only are they neighbors, but our immune system is actually dependent on these guys. The gut microbiome actually maintains our immune system. If our microbiome is not balanced, something called dysbiosis, it sets off an immune reaction. Now, the bacteria can set off a wrong firing of the immune system, which is one way autoimmunity can happen. But the bacteria in our belly are also in charge of the intestinal barrier lining and permeability. So when I say barrier lining and permeability, I want you to hear leaky gut. And if you've never heard of leaky gut, I did another episode on it, but I'll give you a quick overview. Leaky gut is that we have a gut lining, and that gut lining has a really important job to keep certain things in, keep certain things out. And when our bacteria are not happy, it gets damaged, and it cannot optimally function as a barrier anymore. It will have a hard time keeping certain things out of the system, and these smaller holes are supposed to like sift through, become larger, and allow harmful substances like gluten and bad bacteria and undigested food particles to enter the system, which can create an immune response. And creates like the system starts reacting to all these foreign substances and starts attacking them, causing chronic inflammation in the body. So we have a misfiring, we have chronic inflammation. Now, once these substances get past the intestinal lining, because you have this permeability and things get through, this can cause an autoimmune response as well through something called molecular mimicry, which means they see these foreign objects and they start reacting to it. And they create a system of attack towards these proteins in the body, because your immune system memorizes the structure of this, protein, whether it's gluten or something else. It specifically memorizes like a protein sequence. So it can develop a defense next time it sees it. But the recognition system isn't perfect. And as long as the molecule structure and protein sequences are similar enough, the immune system can be fooled into attacking look-alike molecules that are actually your body's tissue, causing autoimmune disease. This happens classically with thyroid Hashimoto's patients. They often have a leaky gut, which allows gluten to enter their system, and then through a pattern of molecular mimicry, every time the defense is attacking gluten, that defense system mounts an attack on your thyroid. And this happens in a lot of autoimmune diseases. So we have this bacteria, it's misfiring, causing leaky gut, and now it is through molecular mimicry attacking the self. So just a quick recap, right? We have this bacteria, like I said in a moment ago. Your belly is, all the bacteria in your belly is right next to your immune system. And if they're not happy, your immune system's not happy. And it can cause this whole big misfire. So now you can see why we start here, even if you don't have GI issues. If you do, that just means things are really, really messy, right? Like if you're bloated and crampy, then yeah, we already know what's in the GI. It takes a no-brainer. But even if you don't have GI issues, that bloating, cramping, distension, we still have to start with your gut because it's the immune headquarters. And for those of you who don't know my story, a million years ago, I got into this because my wife had an autoimmune issue. She did not have any GI issues. If you're bored, I wrote it in my book. You can pick it up. She did not have any GI issues. Her stomach never hurt her. But it turned out that her microbiome was off. And once we fixed it, her autoimmune reversed. So I get it. For those of you out there who don't have stomach issues, you still have to start at the gut. This is really important because your immune system is in the belly. You got to start with your belly. Okay, next question is, how do we do it? How do we make the belly happy? So this system, I did not create it. It's the 4 R's. And the 4 R's basically say the following. First thing you have to do, you have to remove the offending agent. If you're still eating the standard American diet, it's got to go. It's inflammatory. The high sugar intake, the fructose, the alcohol, the artificial sweeteners, they're toxic. They cause inflammation and they feed the wrong bacteria. They cause leaky gut, which causes a whole cascade of immune response and autoimmunity. Standard American diet, out. If you're saying, oh, I don't really eat the standard American diet, there's still some foods that might be inflammatory and still causing and feeding the wrong bacteria. Dairy products, even if you don't have GI issues when you're eating dairy, if you have an autoimmune issue, dairy's got to go. Gluten has to go because it's just a known irritant. But my game changers will tell you, we don't just remove gluten. It's not enough at first to just be gluten-free at first in the removal part. Because for a lot of people, grains and legumes, and I know a lot of you think legumes are super healthy, and they are for some people. But if you're autoimmune, you're going to want to try to get the grains and legumes out. Why? Because there's a cross-reactivity. Your body will react to it as if it's gluten. Remember, molecular mimicry. And sometimes there are even more things we have to remove. And that gets individual. And sometimes we need to do food testing. But the point is, step 1 is remove. At the very least, standard American diet, it's got to go. At the very least, dairy. At the very least, gluten. And then anything else that you might discover is irritating you. Now, this is not necessarily forever, although some people with severe autoimmune, yeah, it might be forever because when you reintroduce it, it might hurt. But for most people, it does not have to be forever because the next thing that we do is repair. We repair deficiencies that are critical to intestinal health. Vitamin A, D, zinc, all of these, when they're deficient, have been shown to mess with the barrier, with that lining. So can create leaky gut, glutathione, omega-3, all super critical for your belly. And then the next R, so we're remove the offending agents, things are calming down. We're taking supplements that are repairing the lining. And then we replace with short chain fatty acids. Some people need digestive enzymes. It's important to notice the order. To just start on digestive enzymes when you're still eating the standard American diet would probably make a mess. So there's an order. And then lastly, we re-inoculate, which means probiotics. I try really not to introduce probiotics too early because if it's already messy in there and you're just adding more bacteria into the game, it doesn't always work out. So you want to clean it up a little bit. You want to clean the weeds before you plant the trees. And of course, all this takes time. It takes time, but you know what? It took you 5 to 10 years to get sick. It's going to take more than one day to turn it around. But now you know the why behind it. So it doesn't just feel arbitrary, like, but why are we starting with the belly? I also have a mold issue. Maybe, but we have to start here. Now you know why. Fix the belly, calm down the immune system. Now, I do have to say that your autoimmunity could also be triggered by toxins, allergens, molds, viruses, stress, but we can't start there. I also say this in my book. You have to start with the gut, because how can we address anything else if the immune system is under attack, right? We can't even, remediate from mold or detox from mold if the belly is still a mess and the immune system's not ready to manage it. Bottom line from all this, your lifestyle is everything. A lot of times you go to your medical providers and they say, yeah, you should do some lifestyle modification. It's like a soft recommendation. But like they'll say to you, yeah, oh yeah, you have autoimmune. Yeah, maybe you should not eat, I don't know, anything spicy. Something like a really soft recommendation. But it's not enough. And I need you to know I'm not against medicine in any way. I prescribe it if I need to. But the lifestyle modification is where it's at for all diseases, and especially an autoimmune disease. You can start treating this on your own, clean up your diet, get some good supplements, learn to manage your stress, prioritize your sleep. And if you feel better, guess what? You're already doing it. You don't need me. You don't need anyone else. You don't necessarily need to do a deep dive into every test that's available in the world. You can start to do this on your own. So to recap, autoimmune diseases are tricky. They take years to diagnose. And early symptoms, for those of you who are not sure, you could be fatigue, joint pain, muscle pain. You might be in that state of pre-disease I was talking about. But that's why they go often unrecognized. And they could be triggered by so many things. But to start healing autoimmunity and reducing flares, it has to start with your gut, because that's where the majority of your immune system sits. And I know this is a lot. And of course, if you want to work with us, we are at The New Method on every platform except for Twitter, because I talk too much. So at The New Method, TikTok, YouTube, Facebook, our website, you name it. Wherever you are, just let us know if you need help. We'd be happy to work with you. But we also create content every single week for those of you who want to try it on your own. That's okay too. Wherever you land is exactly right. At the end of the day, I'm happy that you're here. Why? Because you always knew there was a better way. I will see you guys next week.